Hello, and thank you for tuning in to the Lewis Center interview series. Today, our guest is my friend and colleague, Dr. Roberto Fajardo, who is an associate professor in the Department of Clinical and Applied Science Education at the UIW School of Osteopathic Medicine. In addition to his teaching and research in diabetic skeletal fragility and health disparities in total joint replacement, Dr. Fajardo leads a pediatric medical mission to the city of Neiva, Colombia, supported by the international organization Healing the Children. The comprehensive medical mission, now in its 27th year, was established by Roberto's father, Carlos, and has provided oral maxillofacial, plastic, and orthopedic surgeries to over 4,000 children during its long history. In the last 15 years, the mission has expanded into nutritional and speech therapy, dental care, and mental health services. Every year, medical students travel with Dr. Fajardo, gaining invaluable cross-cultural and clinical experiences in global medicine. Roberto, it's a pleasure to have you here today, and I'd like to get our conversation started by asking you to please tell us a little bit about your bicultural upbringing, how your Colombian heritage has shaped you as a person, and how have your biculturalism and bilingualism helped you professionally?
Well, Rafael, thank you very much for inviting me to be part of these interviews for the Lewis Center. I'm really honored to be part of such a wonderful faculty and institute. So my cross-cultural growth and development. My parents moved to the United States in the mid to late 60s. I am a citizen of Colombia, but I am the only member of my entire family tree born outside of Colombia or Venezuela. The best way I can put it is as far as my cross-cultural kind of growth and development is, as I would tell my daughters, I grew up with all the culture and holidays of my Colombian family. But my Saturday mornings were all the cartoons that all my friends listened to. And so if you asked me what life was like in my house, it was the customs and the cultures of any Colombian family. But I had to adapt to the day-to-day life of being a son of immigrants in the United States. So that meant being able to walk between the family groups that my parents were friends with that were by and large all Colombian or South American, while at the same time navigating relationships with friends and others growing up. And I'm fortunate it wasn't as difficult as it is for others for many reasons, too many to kind of talk about here. But it always informed me and kept me abreast of that there were other things going on in the world at the time when I was growing up. Sadly, Colombia was going through a lot of violence, drug trade. And so I was always paying attention to what were the new updates or current events in Colombia. I had cousins living with me because my uncles and aunts were part of the military and they were under threat. I would say that gave me a global perspective, to pay attention to things going on beyond my borders here in Texas. And gives me a perspective nowadays, unfortunately, in what happens just south of our border in our beloved Mexico. And that is, I've seen these things before. I know what they are. I hope for the best. And so I have an understanding and I try to keep that global perspective. Then how's it informed or helped me navigate professionally? Like I said, I'm fortunate in the sense that I didn't struggle with as many things, I think, as more recent immigrants or immigrants in different situations. Nonetheless, I've always paid attention to the immigrant experience or the Latino or the Hispanic experience in this country. And as I grew within my career, and knowing and understanding and learning about inequities, it gave me a focus. And it dovetailed with my work in healing the children in Neiva, Colombia. And it just really kind of broadened my horizon. The white ivory tower of publication for publication's sake sort of lost its allure. Now it was do the work because it helps somebody else. And that has been my sole focus for about the last 15, 16, 17 years. Because at the end of the day, it's more satisfying to help others than it is to publish one more paper that maybe nobody's ever going to look at and may not have any effect or impact except for, 3 degrees of Kevin Bacon type of distance. So, and it's allowed me that cross-cultural upbringing has allowed me to navigate these waters because I'm here on the south side of San Antonio. I can relate to folks. I don't pretend to be them. I don't pretend to know their experience. But what it's given me is an entree because I speak the language. I understand the culture. And just for, we've talked about it before, but Colombians and Mexicans, there's a mutual respect, a tip of the hat, a love for the arts, for the music. And so I've been brought up paying attention to music and culture from our southern neighbors here. And if you can speak to these things when you meet somebody, just to know a little bit about where they come from or culture or something, it creates a connection. And again, I don't pretend to be in their position. I just want to be someone that shows them warmth and tries to help. And so being able to speak, and also it helps that I was raised in the city. I know what it was like down here on the south side 20 years ago, 30 years ago, when my parents would bring tourists from Colombia to visit South San Antonio and how different the landscape was here. So I know what changes have taken place. So I try to use it in that regard to develop relationships. And it's helped me a lot in that regard, I would say.
It makes a lot of sense, Roberto. I love how it's the Colombian heritage, but you've really explained well how it has helped you with your environment here in San Antonio. But I love that you've also found what seems to be a perfect project. You mentioned Mission Neiva, a perfect project that allows you to apply your personal and professional skills in Colombia as well, and keeps that tie with your family in your Colombian family. Could you tell us a little bit more about the Mission Neiva project, how it started, what your role is today, and also provide us with any update on any developments or Mission Neiva trips on the near horizon?
I love talking about it. It has changed my life. It has changed my family's life. So thank you for asking. And so it was started by my father. My father is a civil engineer. He didn't have a strong stomach for blood, for surgery, for deformity. Just wasn't something he was ever pulled to or interested in, or nor could he stomach it. In fact, it would make him faint. Okay, let's fast forward after a career in civil engineering in the United States, and it's about 1992 or 93, and he's moved back to Colombia, and he has now traveling between the two countries, sitting at a gate, meets a little boy who is traveling between the two countries for surgery, and the little boy is unable to speak, and he starts to pantomime to my father at the gate and try to get my father to play with him. His name was Juanito. And well, from that chance encounter, my father got on the plane, met the Juanito chaperones, and they had a 3-hour dialogue. A year later was the first ever medical mission trip from Healing the Children to Neiva. And it has been ongoing since that must have been 1992, so it was ongoing since 1993. And the only reason we have paused was for the pandemic. And we happily will be going back May 18th of 2023. and restarting our efforts to work on cleft palate and cleft lip, um, plastics, as well as different types of plastic surgery, and as well as orthopedics. And this, like I said, it has changed my life. I went the first year, which was about 16 years ago. My only intent was to share something with my father, was to take something that he'd been talking about forever. And, you know, your dad keeps talking about blah, blah, blah. And then I realized he loves this. He talks about it all the time. So maybe I should go and share it with him. So my intent was to go and be a grunt, not to be the son of the founder and the director, was to just, I'm a PhD in an MD's world or DDS's world. And I just wanted to move papers and help them process patients, and that's it. And that's what I did. And it was amazing. And then the next year, some staff changes occurred. The medical director calls me and says, "You're the new logistical director." And there we go. And now ever since then, I've been the logistical director. And in the last 9 years, my partner here in San Antonio is oral surgeon named Daniel Perez over at University of Texas Health Science Center in San Antonio. The two of us have started 8 years ago to raise money. And since then, we've raised probably over $80,000 for our cause. And it has been life-changing. Like I said before, about 15 or 16 years ago, I stopped being preoccupied with my white ivory tower, and I wanted my projects to dovetail with inequities and helping people, and focus on these two aspects. And so this gave me a different perspective of what mattered, but that I could make an academic life still pursuing and working on these projects and as on healing the children. And as you said, I take medical students, and that gives them exposure to a nonprofit's work as well as a medical mission. It's high productivity. We perform, prior to the pandemic, we performed 170 surgeries on average in 4.5 days. So really that was on average 7 to 8 surgeries per table per day. As well as it gave students the opportunity to engage with physicians from many other different institutions. We have UTESCO, we have Harvard Medical School, we have Columbia College of Dentistry, etc. So all good. And then it allowed me to go home and re-engage or engage stronger with my with the country of my family, and really kind of just work my best to bring some change. And really it started with my father.
Well, it's terrific work, Roberto. You know, you exemplify what we need to do as a cutting edge university is to get out of the ivory tower, connect with communities, affect real world change, and you are doing that. And you know, you exemplify that connection with the community outside of the ivory tower in other ways. Another area of service that exemplifies that, and also that ties you to your Colombian roots, is your participation in the City of San Antonio's Latin American Engagement Task Force, which, as you very well know, is focusing its efforts primarily on engagement with two nations, Panama and Colombia. I suspect you love the focus on Colombia, given your family ties, and that you think it was a wise decision for our beloved city of San Antonio. Could you give us your thoughts on the city's choice of Colombia as a country of priority for the task force?
Sure. And, you know, we both sit on this task force along with about 60 other individuals, all wonderful people who do amazing work around the city. If we are to be practical, and you and I have discussed this several times, is our university's initial focus should always be towards Mexico. because it is our neighbors to the south. But if we are to look beyond that relationship and look at other potential partners, well, I'm happy that the city has focused on both of these countries, Colombia and
Me too.
Panama. But of course, in particular on Colombia, because one, it has been one of the strongest partners that the United States has had, both strategically, economically, and even beyond that. In addition, I'm proud to say that I was brought up in the tradition, and both as a child as well as once I started my professional career here in San Antonio, that San Antonio is a place where physicians or folks who work in medicine really have focused as a point for their landing in the United States. There is a rather large population, probably about 4,000 to 5,000 Colombians in San Antonio. It's the third largest Latino or Hispanic population in San Antonio. Mm-hmm. And so it makes it a great landing point, as well as for the medical center and now the burgeoning different medical nexuses or niduses that we have in San Antonio. So I think this is a wise choice. It's an open market, has, like our neighbors to the south, has a wonderful culture. It has wonderful music, art, pretty good culinary history. Not as good as Mexico, but pretty good. We'll forgive them for that. But it is a wonderful strategic partner. And personally, I will say, as you and I have talked about also before, I've worked with a number of nursing students and medical students throughout the years through Healing the Children. Wow. I have rarely found better workers, better independent thinkers and problem solvers than the youth in Colombia, and I love working with them. That's the type of folks I would love to have in my class every single time. That's not to say we don't have them here in the United States. Absolutely we do. That being said, I'll take them every single day. And so I'm really happy about this. I also sit as the president of Asociación Amigos de Colombia, which is the local nonprofit for kind of the citizens or folks from Colombia who live in San Antonio. Again, my father was part of the founding group that established this nonprofit some 35 years ago. And I just felt like it was a path for me to follow. And I'm happy to say I'm part of it, and that the city is really looking towards Panama and Colombia as these places to develop new relationships in all different aspects: education, humanitarian, medical, commercial, etc.
I completely agree, and I share your enthusiasm, Roberto. And and I also share your concern for the reality that is more immediate to us here in San Antonio. And I know you dedicate your time to helping communities here in the San Antonio area as well. Tell us a little bit about that work. Tell us about your work with Amigos en Medicina.
Sure. So Amigos en Medicina is our free clinic for adult osteoarthritis here on the south side of San Antonio. I started it up with senior clinical research coordinator J.D. Foster, orthopedic surgeon Matthew Morey, associate dean of the School of Professional Studies Dr. Emma Santamaria, and Professor Scott Fraser and Dean Stephen Goffer from the School of Physical Therapy. The point was, from a personal perspective, was to be involved so much in helping folks in South America, but not having done enough in my backyard. That was the starting point. Then, so I felt the need to address my own bias or imbalance. Then it dovetailed with my interest in health disparities. And what we see is that among adults with end-stage osteoarthritis, where the only treatment for reducing pain and improving quality of life is a joint replacement surgery. Now, physical therapy can help, but once they reach end stage, the only thing that reduces pain entirely is a surgery. And what we see, unsurprisingly, is that minority populations underutilize, even though they might have access through their insurance, these procedures by 30%. And so that means thousands of people are enduring pain for some reason when they don't have to. Some might willingly want to because they don't want to go to surgery. Others, it's unclear. And if you look at the map of where orthopedic surgeons and physical therapists, or just underserved communities, let's say, the South Side is a hotspot for underserved communities. So what we wanted to do was establish a free clinic for hip and knee arthritis for South Side San Antonio in our community here in District 3, even District 4, and provide them with a service that would allow them to see an orthopedist and a physical therapist all in the same day, in the same appointment. In addition, because dietary aspects create risk factors for osteoarthritis, so higher body mass indexes, we wanted to address healthy eating options, which are hard here because just to the south of us, Southside Independent School District, which is a population of over 5,000 people, has 0 grocery stores. So their healthy food options are limited unless they want to travel 20 to 30 minutes. And yes, you would hope that they make good decisions, but it should not be that difficult to eat healthily. So we also included that component to our program. And so far, we started this year, in 2022. We've had 3 clinics. We've been able to discharge folks because they have improved greatly with their pain levels just by doing physical therapy. They weren't end stage folks, but the physical therapy helped them. And in addition, we've created interprofessional experiences for physical therapy students, as well as DO students, where as soon as the patient walks into the room, into the lobby, one student from each school works together, meets them, and follows them through the entire encounter. It creates a relationship between the patient and us because they will follow them all the way through. Often the conversations lead to revelations about their lives, their experiences that can help inform what we can do for them. As well as it teaches the DO student as well as the PT student, because they walk into an MD's office or a physician's office, as well as a physical therapist's office or clinic, exam room, and they see how the other profession works. And this is real time, real practical experience in interprofessional education. And it's something that we've prided ourselves upon, because we also give them the background of the anatomy, the physiology, the pathology before they even make it to the clinic. So it's been great. We will continue it. We've had some grant funding for it, and we look to try writing more grants. But it's our way of being part of this community. This medical school, the School of Osteopathic Medicine, its greatest success, in my opinion, will be not in the nature or science papers that it could produce, but in the community work and the changes in people's lives, because that's a life well lived if you just help other people.
Well, and it's the school is well situated, right?
Absolutely.
In the city to achieve that. Roberto, I don't know how you do it. Congratulations, my heartfelt congratulations, and my hat is tipped to you, my friend. I commend you for all the work you're doing. And also let me take this opportunity to thank you for engaging with the Lewis Center and for embracing our mission to strengthen and expand understanding across the nations of the Americas, and to bring that sensitivity back to our city. We'll continue to be in touch, of course, as we always are, and I'll see you at the forthcoming World Affairs Council meeting, if not sooner.
Rafael, it's been a pleasure. I'm one of the best parts of my work here is that we got to know each other. And I really believe in what the Lewis Center is trying to do. You had an excellent event with bringing former President Vicente Fox, and I look forward to trying to help in any way with any future events. But I think you're taking it in a wonderful direction, and you can always count on me to be part of it and help in any way if I have to be a grunt or if I have to help in anything else. It's really an important institute or center at our institution, and I look forward to seeing further success.